So, for the record, my name is Jonathan Jones. It is my pleasure, my privilege to be your host and moderator for this afternoon. Every Sunday, we have a program like this one where folks are invited to come and learn at the feet of Dr. Prasad. Dr. Prasad was professor of University of Colorado School of Medicine for some 30 years, and yet he's still discovering new things. He's still writing new papers. He's still being invited to lecture all around the world. And the man is 91, 92 years old. I keep getting him and my mother-in-law mixed up. My mother-in-law is 95. And so I think Dr. Prasad just hit 91, if I remember correctly. But it's hard to believe that the man is still functioning the way that he does at this tender young age. And it's sad that as you get older, when you finally learn something, you finally get some ability, some insight, some knowledge, and that's when you start to slow down. But we're very fortunate that Dr. Prasad has not started to slow down yet. This man is still in full steam. He's still, like I said, doing lots and lots of things that is very helpful to many people, especially to those of us who have gotten to know him over the past 10 years or so. But as you saw from some of you saw from the opening slide that we shared, the month of March has been considered a National Kidney Month. And I guess that really expands out to National Kidney Awareness. So it's a time when the government and the health department, National Institute of Health, has determined that it's a good idea to start giving some awareness, focusing some attention on certain specific health issues. And so we take advantage of those declarations because then it gives us a chance to spotlight a lot of the benefits of micronutrients, a lot of benefits of Dr. Prasad's research and what it has done for so many people. And part of it is kind of sad, I have to admit to that, because a month like this reminds me of just how valuable this information would have been in my personal life. Because what got me started down this journey, my why, the reason I do what I do, is because I watched my mother die. Now, I grew up seeing her take injections for diabetes. And I always said to myself, wow, not only did I not like needles, excuse me, I just thought, wow, I certainly don't want to be taking needles in my stomach. I just, but I saw this, and my mother always told us, if you ever see me kind of fade or droop out like I'm out of touch with reality or something, she said, make sure you give me some orange juice or give me this, put this in my mouth. Here's where I always will have it. So she always told us how to break glass in case of emergency. So we knew exactly what to do if mom was ever in trouble. So I personally decided when Joanne and I got married, her father also had diabetes. We decided that we didn't want to go down that road. We saw how um, devastating it was. I'm just going to mute everybody so you guys can unmute later as we're having discussion. Um, I saw just how debilitating it was, and so did my wife, Joanna. I mean, she saw her father becoming an amputee, and the effect that it had emotionally, the toll it took on the family, all those things. So we said, yeah, well, we just don't want to go down that road. So we began doing the kind of research and making adjustments in what we did, our behavior, our food, so that we could avoid getting diabetes. So, but fast forward, my mom eventually got to the point where her kidneys had failed, and she began to do dialysis. She was a candidate for peritoneal dialysis, so she could do it at home. And I don't know that that's necessarily a good idea, personally, because you really have to be, there's so many things that can go wrong. You can get peritonitis, and that's an infection you don't want to get. I'm here to tell you on that one. You do not want to get peritonitis. But anyway, my mom eventually started having some complications with her dialysis. She ended up in the hospital, intensive care, and I knew nothing of what I know now. So about health and wellness. All I knew was the immune system was important, and I had been trying to give her information about that. So imagine my shock when I get to the hospital in the intensive care. My sister calls me late at night, 12 or 1 o'clock in the morning, wakes me up and says they're asking her to sign a DNR. And I said, oh my God, you got to be kidding me. I mean, is that serious? So I had no idea that we were talking, the medical staff was going to be saying, please don't ask us to resuscitate her again. So I rushed over to the hospital, and eventually I asked the intensive care nurse. It was around 2 or 3 o'clock in the morning, because this time was just going on, and I'm seeing them do nothing. I said, so what are you doing for my mom? And she says, to be honest with you, Jonathan, we're praying for her immune system to kick in. And the coldest slap in the face I've ever experienced, because that was for the first time that I thought that, oh my God, my mom might not make it. You're praying for her immune system to kick in. I'm a firm believer in the power of prayer, but we had that covered. I thought they were actually doing something. And sure enough, my mother she would not see another day. She died that day. Now, I say that to say what that nurse said was significant, because the immune system does play a huge role. And we're going to touch on that a little bit. Dr. Prasad his comments will kind of clarify that a little bit, and we'll explain why that is the case. And then we're going to hear the good news, because I don't mean to just depress you here with this kind of story. I'm just laying the foundation for you. But the testimonies that you're going to hear after Dr. Prasad's comments is just going to blow you away. Again, especially if you're here for the first time, because it's hard to believe that any nutritional supplement, while they do not treat or cure a disease, it's unbelievable the potential impact on the human body when the right food goes in. It's amazing the potential impact that it can have. And we're going to show you some of that here in just a couple of minutes. So again, National Kidney Awareness Month. And by law, we have to make sure that you know that the FDA has not evaluated statements that we're making. When you hear testimonials, they're purely anecdotal. Results are atypical, and that means that what happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the authorized representatives are making claims that any supplements recommended will treat or cure any disease state. This presentation is for information and educational purposes only. It's not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So now, with that in mind, here are some of the sobering facts, the latest statistics. We're talking 37 million adults. 14%, 15% are estimated to have chronic kidney disease. So in 2026, that's the here and the now, 800 million people worldwide are living with CKD. That's more than twice the number from 1990. So just back it up 35 years, and the number has doubled. It would have been 400 million people worldwide with CKD. Now it's 800 million. That's knocking on the door of 1 billion people. So 1 in 7 is the number that they say that are being affected. This thing has officially entered the top 10 causes of death globally. Can you imagine that? It's in the top 10 now. It's now the 9th leading cause of death, and it kills more people annually than breast or prostate cancer. Now, the last time we had discussions about cancer, you might remember that the number 1 cancer killer is breast cancer in women, and the number 1 cancer killer in men is prostate cancer. But did you see this? Now, CKD is in the top 10, and it's killing more people annually than breast or prostate cancer. So it is a serious, it's a serious matter. It's a serious matter. And I think everyone should pay attention to it. And I think everyone has been affected in some way or another by this dreaded issue. It's the silent factor you see on this slide. Here's a quote. It says that knowledge is the first line of defense, and most people don't feel sick until the kidneys are significantly damaged. And I know that to be the case because personal friends I know that ended up with serious issues. One good friend of mine ended up with a stroke, hemorrhagic. Somehow he managed to survive, but it all traced back to his kidneys. Walking around not realizing that he was in serious trouble. I had another friend that was having some manifestation in his urine that he was having trouble with his kidneys, but prior to that, no idea that the problem was rooted in kidney issues. So most at-risk individuals never receive early screenings, and that just allows the disease to progress completely undetected. 90% of people with CKD are completely unaware of it. 1 in 3 Americans are currently at risk for CKD. 1 out of 3. $140 billion is the revenue. And again, I will never try to imply to anyone that someone has a financial interest in this, and that someone specifically benefits from the fact that $140 billion in revenue is circulating because of this disease. So I would never try to imply that. So please don't take the fact that I show you this number as an indication that I'm trying to imply that there's good money to be made in this specific disease. But once the person completely reaches kidney failure, the costs explode, because now we're talking about dialysis and transplant. And I forget, someone mentioned the statistic as to how much money each visit to each treatment of dialysis is. Maybe somebody can look that up for us and can share that in the comments and just tell us how much, if a person is going in for a dialysis treatment, how much does the kidney center make for that? There's one affiliate that lives here in Florida, Sanford, Florida. And we did a presentation there at one of the community centers. And she pointed out, and I saw it myself, that it seemed like every 2 or 3 blocks, I may be exaggerating a little bit, but there were more kidney dialysis centers in that little town than I've ever seen in my life. And if you look up that little town, it's shocking to see, but they were everywhere, and everybody in the little town had CKD and was on dialysis for some reason or another. So what's the goal? The goal is to shift from expensive late stage sick care to affordable early stage well care or wellness. So that really is the goal. And that's the reason why we're doing presentations like this and passing on this information, because it just does not have to be. You and I don't have to be part of the statistics. We just don't. We can avoid it. There is a workaround, and Dr. Prasad's information and his research proves that there is a workaround. 75% of all new kidney failure cases are caused by diabetes and high blood pressure. So those are the big two. Those are the drivers for kidney disease. Diabetes, elevated glucose, it damages the kidneys filtering mechanism. And Dr. Prasad described it once. He said that because it was kind of sad. I feel a little ignorant sometimes sometimes I ask him some of these questions, and I said, "But Dr. Prasad, why would glucose be in the blood? Why would it have an impact on the kidneys?" He said, "Well, the red blood cells are not supposed to be transporting glucose and delivering large amounts of it into the kidney. They're supposed to be delivering oxygen to the kidneys, not glucose. So you slam a massive amount of glucose into your kidneys. Well, guess what? That puts a strain on that kidney. And the kidney is now dealing with oxidative stress and free radical damage because it's being slammed heavily by something that's not supposed to be being overwhelmed by. And then high blood pressure, uncontrolled hypertension, that strains and scars the kidneys' blood vessels. And that is extremely true. And that's a real problem. Whole nother discussion in itself as to how many people are dealing with it. But the secondary risk factors, heart disease, obesity, family history, smoking, all those things play a role in contributing and driving a person toward kidney failure. So wake up, folks, wake up and pay attention. Look at this. These are facts. This is not just, a set of numbers because no one had anything better to do. These are real numbers. So manage your sugar, keep your pressure under control. And I think one of these slides might even say it, that your goal should be to keep your blood pressure below 130/80. That's where you want to be. Now, they used to put people on blood pressure medications to try to keep everybody, including seniors, at 120/70. But they figured out finally that the medication to do that had so many side effects. It was actually doing more harm than good. So they realize now that the number needs to be a little bit more realistic, for seniors. So try to keep it at 130/80, and that puts you somewhere in the safe zone. 34 to 38% are over 65 and older. That's where the prevalence is. Black Americans are 4 times more likely to get CKD. Hispanic Americans, 2 times more likely, and Native Americans, 2 times more likely. A lot of it has to do with lifestyle habits and exposure to sometimes lack of exposure, to high quality foods. Sometimes lack of exposure to quality medical care. My personal opinion, a huge amount of it is lack of exposure to this kind of information, lack of exposure to the education as to what leads to it. Because as you're going to hear Dr. Prasad say it, that there are lifestyle choices that can contribute to this, but he says no one will change. Folks just don't want to hear it. People don't want to change their life, so they'll continue to abuse the good things in life just because money and circumstance will allow for it. So smoking, alcohol, and other excesses that can create a problem. And often this happens to be in some of these communities. So it's really sad to see that. So if you're on this listening, if you're within listening range of this, in fact, for those of you who are on YouTube, thank you for joining us. Pass this on, share this information with others. But if you fall into that category, that's the highest risk, that I fall into. We're 4%. Black Americans are 4% more likely to develop kidney failure. That's scary. That's scary. One of those earlier pictures you saw, it was a person with their hands on their back. So anytime I start feeling that lower back pain there, even though I know I've got herniated disc, my first thought is, did I drink enough water today? Because you do not want your kidneys to be under strain. So the prevention blueprint: control blood pressure, stabilize blood sugar, stay physically active, stay hydrated. Those are the main things that you want to do. We've talked a lot about the EGFR number here on in our discussions here on Sunday. We've had many people who have been screaming up and down, blown away by seeing their EGFR numbers go from 10%, 15% to 35 to 40 to 50% or even higher in a very short period of time. So we've had many people tell those stories. We don't have time to share all the recordings of those, but maybe if some of you are on this meeting today, you can feel free to chime in, and you can share your story once we get to talking about the testimonials. But I really would like to just get out of the way for a minute, and let's hear from Dr. Prasad. Some of the expressions that he's made on this subject, because they're mind-boggling. It's thoughts that are vintage and will never be out of date. So Dr. Prasad was the world's first radiation biology PhD. the first in the world. His products, his formulas have been awarded more than 10 patents in the United States. So he's still coming up with unique products, unique formulas. This man is not some college graduate who just came out of school and is hoping to formulate some product that's going to make a difference in the world. No, he's done it many times over, and still producing patentable formulas that's making a huge difference in people's lives. And there's the number someone pointed out there: $500 or more per session. And someone else found another chat GPT says $250 to $300 per treatment, all depending on the insurance company, but just round that out to $500 per. And the number of people living with chronic kidney disease worldwide, just do the math, 800 million. 800 million was the number. 800 million. Multiply that by $500. And that tells the story. But Dr. Prasad has had lots of money poured behind him in research because of his brilliance and his excellence. He's discovered a number of things, two very significant things that if you're in the natural world and you're looking for alternatives, should make your eyebrow raise. This is the man who discovered the anti-cancer potency of vitamin E succinate. First of all, I didn't know personally that there was more than one type of vitamin E, but Dr. Prasad did, and he figured out which one, oh, by the way, happens to kill cancer cells. So even when you see vitamin E on his formulation, don't you dare say to yourself that it's just the same old, because it absolutely is not. So Dr. Prasad, his research is impeccable. So personally, and by the way, this vitamin E succinate, it crosses the blood-brain barrier. So I'm thrilled to know that if I'm putting vitamin E in my body, that it's, oh, by the way, killing some cancer cells while it's doing its job. He did. He also discovered that butyric acid is an anti-cancer agent. So that comes from fermentation of certain fibers in the gut having to do with probiotics and prebiotics. So Dr. Prasad knows quite a bit on the subject. He figured out that this butyric acid is an anti-cancer agent. So his formula for probiotic and prebiotics is in a class all by itself. Many scientists are standing on this man's shoulders. In fact, he's been published more than 250 times in peer-reviewed publications, and there's more than 450 references to Dr. Prasad and his work in PubMed. So he is no joke when it comes to this area of expertise. So let's hear from, let's take a minute to talk to Dr. Prasad. I captured some of his comments from before, so let's share that with you now. And welcome, please, Dr. Kedar Prasad. Dr. Prasad, sir, we can't even, we repeat this sometimes, and sounds like a broken record to you, but let me tell you something. We really appreciate your presence and what you offer to us by the way of knowledge and sharing with us the things that you know and that you're aware of. So thank you for joining us today.
Thank you, Jonathan. I always enjoy with you and engaged family. And I'm always willing to answer anything I can on this disease. Today is kidney month, so I think we will focus on kidney.
Well, tell us. Well, you heard the statistics. That was all from the CDC and other places.
And I was aware of most of the statistics because, as you know, this morning, 4:45, I'm going to present through the Zoom call exactly on the topic of diabetes in Dubai.
Oh, my.
And Dubai time would be 3:30. My time would be 4:30 in the morning.
Oh, my goodness. So okay, you can practice on us now. Go ahead. Practice on us.
And so, but I have a slides and everything, but in any way, so it happens to be that I review those things on diabetes. And like you mentioned in your introductory remark, diabetes is one of the major causes of kidney disease. And also second is the blood pressure. Also another one is not as important, but sometimes it becomes important, is infection. Sometimes you get infected in kidney disease. And some of the early signs, because like you mentioned that many people are not aware of kidney disease. But what I read about it, that some of the early sign of beginning of a kidney problem is that frequent urination in the night, one. And second thing is that when you urinate, it forms foam. If they form a lot of foam, that is...
Yeah, that foamy urine. Okay, interesting.
Yeah, I didn't know that. I mean, I was reviewing things that they claim. I don't know if it is really, but they say that it is possibility that these are some early signs. And if you get a blood test, and then keep an eye on EGFR, which is a function, creatine, for example, also a function of kidney function. And so, and a higher the number, better it is, lower the number, bad it is bad. So that many ways you can kind of have some idea of what is going on. But major question is that all this disease that does it, what it does, why it causes those kidney disease. First, the major function of the kidney, as you know, is to clean up your all toxic chemical from the blood. So blood remain very nice and clean, and that they remove all the things, bad things metabolized through the urine. So that's one of the major function of kidney. But the thing is that I
Yes,
was
sir.
looking into the
With an S
literature
at
that again, just like
all.
diabetes,
Downtown
because it is
London.
increased oxidative stress and chronic inflammation is the major culprit of diabetes. And if the diabetes is not controlled, for example, all the diabetic medication that we take, oral medication or insulin, they treat the symptoms of the disease, not the cause of the disease. So none of the oral medication that you take reduces oxidative stress and inflammation. So what happens? One drug becomes resistant, the drug changes different drug, then they change a different drug. So there are 4 or 5 different medication, and they perform everything by different mechanisms so that glucose remain down. But again, nothing does which inhibit or reduces oxidative stress or inflammation. Not even one medication. So,
Wanted to because da da
my
da 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 da.
suggestion to
It's
people
been
are
done
there.
over here.
First, for prevention point of view, it is important, like you mentioned, Jonathan, that you take a proper nutrient, proper diet, exercise, and so on. But see, when you recommend the diet and exercise, nobody follows it, even though it is a common sense to do it.
Common sense.
But human behavior is tough to change. So what is the best thing? You try to educate as much as possible, and hopefully that some people will follow it, at least to some extent. And so it is very important. Then second, what is the second best thing is to take a micronutrient, appropriate kind of well-tested micronutrient, which can reduce oxidative stress and inflammation. And they have been, as you know, we have tested all these things in our clinical study as well as in animal study, and they turn out to just a very good one. And so in this case, whether you are taking medication, still it is okay to take this because then you will improve the effectiveness of medication. Doctor may like to reduce the, and even the people who go in a later stage, like you mentioning, on a severe kidney disease,
Yeah.
at any stage of the kidney disease, you can intervene and reduce the rate of the progression. You cannot reverse completely back to your normal kidney, but at least block the progression so that you maintain a good quality of life while you are staying in this world. And so I think this is very important to remember. It is not just when you start. Any time in your life you can start. If you start before the disease starts, you will never get the disease. If you have a disease and have a medication, you will block the effectiveness, you will improve the effectiveness of the drug and further reduce the progression of the disease. So you will never go to not only kidney disease, but eye disease, peripheral neuropathy, and all kind of diabetic-related complication occurs. So my advice to everybody is that at any stage of your life, you take a proper nutrient, of course, diet and exercise, knowing fully well that you will not follow it. And so this is, but sometimes I violate myself, So I think it is just one of those things that
It's a fact. It is a fact, and I just hate to admit that is the case where most people will not, for the most part, make their diet a priority. And all of us will fall off the wagon once in a while.
Yeah, once in a while, but not every day, but no, once in a while. I follow diet reasonably well. And so I think it is very important that at least we have all these things available very easily. You don't have to worry about it. Just take a hydro or micro daily EMF capsule, your preference. And sometimes people don't like the taste of hydro, then you take capsule. And when you are taking capsule and you think you can swallow it, like I do, and I put a content in a yogurt and then take it. It is as good as hydro. But
I have to agree with you on that one. I take it every day, at least twice a day, and I'm finding it to be extremely helpful. When I was in well, as a child, I always had problems with my kidneys or my bladder. But I have zero issues now since I learned to focus in on my immune system.
yeah,
But when we look at this ingredients panel, Dr. Prasad, it really doesn't look like there's a whole lot unique here. Your combination is what's unique here, but you get added so many things here that is beneficial for the entire body, but especially the kidneys.
yes, especially kidney oxidative stress. But you want to be not only reduce oxidative stress, but you should provide your brain, your kidney, all organs, and necessary B vitamin that they must have it. And
Mm-hmm.
so B vitamin has nothing to do with oxidative stress, but it is simply improving the function. And
Mm-hmm.
so I think in this scenario, as you know, um, recently I have examined many formulation that Beth sent me, and people are using those formulation, and you wouldn't believe it how bad they are.
Ooh,
And so I make my comment. If they're good, then I say it is some benefit, but most of them are just nothing.
wow.
It's so disturbing. But like places like different places like Montana and other people, all other kind of people, they're taking all this kind of junk vitamin that
Wow.
obviously some people have reached them, and we have not been able to reach that. And I think Beth is trying to reach everybody, and so the question is, I'm sure that in all ethnic group, white or black or anybody, uh, until we reach them, they don't know. They take all kind of junk every day,
That's
and
right.
and one on the product I see on the television all the time is the XL Omega,
Oh yeah, Omega XL. Mm-hmm.
Omega or XL, yeah. And I said, okay, I might let's see what the ingredient of Omega XL is. And a doctor testified, the patient there said it looked like a real one. But I found that DHA, which is the most important component of omega-3, is 0.01.
Oh
And I
wow.
have in our formulation, I don't know, I have probably 500 milligram.
Wow. So it's almost non-existent in this
Non-existent.
mega $1 million product.
Yeah.
Wow.
But see, in a commercial market, you can sell almost anything.
That's right.
But
That's right.
another sign that's very interesting, half an hour in business channel, in a Bloomberg channel, I watch quite a bit. And so they half an hour devoted purely on GLP-1, how great it is. It is great, but they never mention toxicity. They mention all the good stuff.
Mm-hmm. Mm-hmm. Yep.
See what I mean?
Unbelievable. Yes, I do.
Yeah, and so
Yes,
the
I do.
people,
Ozempic, you're
I mean,
talking about.
Ozempic, for example, is a good example. I mean,
Mm-hmm.
many people have lost weight with Ozempic, and there's no question about it.
Right.
But it has serious acute side effect, and also late adverse effect because they have been there for market for some time. Because initially, as you know, they were FDA recommended for diabetes,
Mm-hmm.
but all the commercial advertisement, you don't see any of those things.
Mm-hmm.
And
Mm-hmm.
and our product that we have developed, which has also GLP, not only GLP-1 but also GIP, and so the question is, that's why I have not heard any toxicity issue, acute toxicity from any. Maybe Jeffrey is here; he can expand further because he gets all kind of email from people. And but anyway, so back to the kidney function. So I think if you keep your body at a markedly reduced level of oxidative stress, because as you grow older, if you don't take all this kind of good diet or any even good diet, if you take it,
That's
still
right.
you have a low level, but still you will have oxidative stress. And so if you want to prevent and have a good quality of life, and no kidney problem or any other organ problem, then you have to adopt earlier the program that we have developed, namely,
That's it. That's it.
at least two is a must, two is a must one.
Yeah.
One is micro daily, either capsule or hydro, or a probiotics. These two
That's
are
it.
must.
That's it. That's it. I tell you what, Dr. Prasad, um, I have an example of a woman, Ms. Olive, who had end-stage kidney disease. And I'd never met this woman before, and to this day.
I'd like to hear, yeah.
But her daughter, Corrine, interrupted our call one night and said that she wanted to tell a story about her mom because she was blown away by the results. All she did was give her mom 5 capsules of your product, Microdaily EMF, while her mom was in end-stage kidney disease and on the verge of dialyzing, and she was not producing any urine at all. So they had put in a Foley and everything. So we've got that recording, and we want to share that with you.
Yes,
because there's a bunch of people on here now. A minute ago, I told you it was 120, but now we're up to almost 150 connections. And some of those have 2, 3, and 4 people at their locations. So you got quite a few people. Many of them have never heard Miss Olive's story. We do have Coraline that's on the call now, and I'm sure she can give us an update on what ultimately happened with Ms. Olive. So I'm going to share that now. And as folks are listening, remember the disclaimer that we read earlier, that testimonials are purely anecdotal. What happens to one person may or may not happen to you. But we're just sharing a firsthand story of a woman who talked about her mom, and she's excited. She was in this, what to me, it struck home with me again, because it was like what happened to my mom. It's like I felt like, here's somebody should be able to do something. And Corrine had an immune system kicker in her, and it worked. I just wish I'd had that earlier. So, so too bad you was too busy with the Army at the time that I needed your immune system kicker in her. So hang on one second here with diabetes. And his brother-in-law's story is just amazing. All right, it's amazing. So
can I talk real quickly? I have to run. Is it all right?
Your name, please.
My name is Corrine.
Okay, Corrine.
All right, so I just have to say it. So I started, I've been pre-diabetic, and I started the entire supplement last Friday, and my blood sugar been running like 115. Now, since I start using it, it's been like 88. Anyway, I'm not even here to talk about me. So my mom, I'm a nurse, and my mom been in the hospital Friday morning. Congestive heart failure. She's also diabetic, and she has chronic kidney stage 4. So she has all this fluid on her. They put her in MSICU, and she's been having a lot of problems. I was scared to death as a nurse, thinking I'm going to lose my mom. Difficulty breathing, her lungs filled with fluid and all that. Anyway, I said, I want to try it. I want to try it on her. But then I'm like, oh my God, should I not? So I went to the hospital, and I mixed 4 capsules of the Micro Daily in the applesauce, and I gave it to her yesterday morning. Now, she wasn't peeing. They're thinking diabetes. They're thinking dialysis, because her kidney functions are way, way off. I'm like, oh my God, I can't give her dialysis. Now, I kid you not, within 5 hours of me giving that to my mom, now they had put a Foley in her because they want to see if the urine output was coming. They're like, we don't see urine, maybe she's retaining. Now, within 5 hours, that urine, that bag had 800 liters of urine in it. I kid you not. Now, then her hemoglobin was a bit low. So the nurse said, is she anemic? Yeah, she is. So they said, and they kind of tugged the Foley a little bit. So there was a little bit of blood. So they did a hemoglobin to see what her blood count was. Now, with the bleeding, her blood count should be lower. Her blood count went up by 2 points. 2 points. I kid you not. Then, my mom, she's been sleeping ever since I put her in the hospital, sleeping. She would open her eyes and go right back into a deep sleep. When I went back to her yesterday, she was up singing. All last night, she was peeing like rain. All right, in the Foley catheter. I went back this morning because she's in MSICU now, and they're saying, hey, you know, they're asking me, is she full code? Yes, she's full code. All right. I went back this morning and I gave her another dose. The cardiologist, they called me and they said she might go home Tuesday. So the nurse, they did a urine culture. They were like, oh, you know, we gave her some antibiotic just to make sure. But she just turned around, a full U-turn back to okay. So we think it's a dose of antibiotic that did it. But I did not tell them what I did because I wasn't supposed to do it. And I'm a nurse and I work at that hospital. So I couldn't tell them. But
Yeah,
oh
right.
my God. You know, I just had to say it. I am driving now to go give her another dose. And I just had to say it because I tried it so I could introduce it to my patients. But when I see what it did to my mom that I thought I was going to lose, I'm like, oh my God. So
Karen,
that's my
wonderful.
story. I don't even want to talk about me right now. I'll talk about me another time. But
Okay.
this just helped my mom. Her kidney function, her BUN and creatinine started going up to the normal level. It's not there yet. It's going up, going in the right direction. Her blood glucose, because when they check it, it was 244. When they check it, it was 118 again. Oh my God.
How old is your mom, Karen?
87.
Wow.
87. And now, nice clear urine coming out. That wasn't coming before. They were setting up dialysis for her.
Which
No, the doctors is like, oh my God, okay, she's doing very well. But, you know, we don't know. The nurse is thinking it's the antibiotic. It was not the antibiotic.
Antibiotic is amazing. Yeah, just amazing.
It was the microdaily that did it.
Which formula did you give your mom? EMF or original?
The red label.
And you gave her
four. I gave her 4. Yes.
Okay.
Karen, you've your story will undoubtedly help a lot of people because
oh my God. I am a nurse. I'm almost a nurse practitioner. And
wow.
I was a bit hesitant to give it to her. But I'm like, you know what? They're telling me my mom is doing very bad. You know, I'm just going to take my chances. Oh my God. That's my mom sang a whole hymn this evening to me. What it was doing for me, but I was a bit, especially with her age, and she has a lot of stuff going on: congestive heart failure, diabetes, hypertension. She had a heart attack before, she had a stroke before, a whole lot. And oh my God.
So Dr. Prasad,
I just had to say that.
Kareem was out of breath relating that story, and she just couldn't.
I mean,
look at the excitement that she had.
If you look at that, her oxidative stress was so high in her body than any and the way they were giving it like in a apple sauce, it gets quickly absorbed and did the magic. I would say that's a magic. Theoretically, I would not have accepted it. Accepted it.
She's a nurse, and so we're listening to a professional relate the story about her own mother.
Yeah.
So this is not just some Johnny come lately or Susie around the corner telling a story.
And she was corrected not to tell anybody because she was working. They might get fired for her.
Yeah. And we got it on blast now, so I don't think it's ever traced back to her. Corleen, are you here?
I'm here, Jonathan.
Well,
hey, Dr. Prasad, how are you?
Corleen.
Wow.
This is one of your
amazing story.
Amazing stories here with Miss Olive. What can you share with us?
When we first heard Miss Olive on your call, Catrice did some research and she said she's on our team. So we reached out and we started talking to them, and Miss Olive, they sent Miss Olive home and told her she would be dead in 3 days. And there was nothing else they could do. And that was it. And Kareem was just so determined that she continued to share that product with her mom. And she became a favorite of the company, if you really think about it. Everybody was sharing, her story. And Miss Miss Olive, I mean, she would come on, you guys, she would sing to us. Dr. Prasad had a chance to meet her, you know, via Zoom. And Miss Olive lived 19 more months, you guys, because of this product. 19 months. And unfortunately, her daughter had a caregiver and she was at her home, and I don't know exactly what happened, but she fell out of her bed. She hit her head. She went to the hospital. And even with that, we called Dr. Prasad, and Dr. Prasad talked to the hospital pharmacist, and they agreed to the micro daily. Dr. Prasad wanted them to give brain boost, and they would not agree to the brain boost. I forgot why. They said it was an ingredient, and they wouldn't agree to it. And because the interesting part, Jonathan, you did a piece on how sometimes the color variation was different. So all of the product that I had was that bright orange, because sometimes our brain boost is that pale color. So she couldn't sneak it into the feeding tubes like she had done before. But if she had not had that fall, she was planning to go on a family cruise. They had t-shirts made and everything. Miss Olive was just amazing. So, you know, when I heard you say that, it like kind of brought up some emotion, because I said, wow. But thank you, Dr. Prasad, for all you do.
Yeah.
Thank you for the update, Coraline.
Thank
we
you.
we need to hear that, and we need to know this stuff is real. It's changing lives.
Right.
19 months, but let me just say one more thing, John. Not just 19
look,
months.
I would have given anything to have 19 more months with my mom. So that's
19
all I
months
can
of
tell you.
quality, though.
Yeah.
She
Quality
wasn't laying in the bed. She was out functioning. She was going places with her family. She had 19 more months of quality life because of these micro daily products.
At 87.
Yes, so we did a birthday for her for 87. We did 88, and I guess this would have been 89th, because her birthday would have been May 31st. So yeah, she was just, I mean, and we used to send her little gifts, Jonathan. So like on her day, we sent her a box of like 87 $1 bills, and she's like, oh my God. I mean, where she was just excited. You guys, I'm telling you, 19 more months of quality life. You can't, that's priceless. You can't buy that.
At that age, yes.
Yeah.
No.
So thank you again.
She was
I would
younger
give
than me.
everything. Everything I have, I would give to get my mom back for 19 more months. So no question about it.
Yes.
That's beautiful.
Me too.
Well, Dr. Prasad, for anyone who cares about a family member and wants to have a chance, is it taking a chance, Dr. Prasad, for them
there's no downside. That's the thing. It's not, the worst thing would be there's no effect, but there's no downside that it will aggravate the disease. That's one good thing about our product, is that there is no adverse reaction. In other words, in all cases, it has been always positive, but sometimes I always say that, well, the worst thing happened, it has no effect. You know?
That's right. That's right. Well, that's good. Well, there was one question that came up earlier when we were talking about the foamy urine. Hayden asked the question, is foamy urine and bubbly urine, is that pretty much the same thing?
Yeah, bubbly, about same thing, yeah.
So if it starts to get bubbly, but foamy is pretty dramatic when you see the foamy urine, right?
Yeah, you have
like
to not just a small one, have a small amount. You have to have a large area of the urine, the cover.
A large area you can see right there in the toilet.
Not in a small area where you're just peeing it and then accumulating.
Bubbles is one thing, but foam is a whole different story.
Yeah.
Okay. All right. So that may not, Hayden, that may not necessarily be the case, but look for foaminess, and that may tell something. Jeff, do you have? Can you relate the other situation where you had that was not just in stage kidney disease, but this person had already reached the point of dialyzing? Can you tell us about that situation, please?
I can, and I apologize. I haven't followed up with William here lately. I promised to do that, but yeah, let me just share William's experience, and he goes on a little bit talking about the significance of commitment to the product, how long he was on it. You've just described some dramatic, really short-term benefits, but William talks about in the like 200 plus days worth of commitment to supporting his body through nutrition. And so yeah, let me just share William's experience here with everybody. Sorry, I should have had it ready to go. I was thinking this would be a perfect time to share it, but let me just here we go.
On a micro daily January the 8th this year, 2023, and I have had a great experience so far. I had high blood pressure, which was so high that's what knocked my kidneys out, and I really hadn't gotten really any relief from the high blood pressure, and until I got these macrodated products into my body. So it's been 229 days since I've been taking the product, and I have seen some great benefits in my body. I have, in 2009, I had a car accident, got hit in the back and gave me whiplash, and my right and left hand, pointer fingers and thumb went numb. In 3 months, the left finger and thumb came back to life, but the right finger and thumb stayed numb from 2009 to 2023 when I got on the macrodated product. So I know it was macrodated that stopped that numbness. And one evening, my finger and my thumb was just like electricity was going through it. And I just hit my hand on the bed trying to stop that pain. But that next morning when I woke up, there was no numbness in my finger and right thumb at all. So it had cleared that up. And the blood pressure has been up and down a little bit, but everything else has been great. And when I was in college at 18 years old, I hurt my knee real bad. And now since I've been taking the macrodated products, that knee is now just totally like I never have damaged it at all before. And I didn't do any surgery or anything, just taking these products. So it's been a blessing to me in a lot of ways in my life and with different things. And one thing about my back, I never have ever had a back injury to my knowledge or anything in any way. But I noticed since I've been taking these macrodated products, I feel as though I'm getting total hydration because my back feels just really relaxed and really at ease. And it's real smooth feeling now, just like something great has happened. So those are some of the things I realized what was going on in my life. And also, I haven't urinated in over a year and 3 months or so because of the kidney failure. But today, I had a different type of urge to urinate. I have had urges before, but it wasn't the same feeling I had today. It wasn't even in the same place. It was just different. But anyway, those two urges I had today, I was able to urinate for the first time in a year and 3 months, twice. Wow. It wasn't much, but it's starting. So I guess the arteries and the veins and getting ready to start to unplug. So it's taken a little while, but 228 days. But look how long it took me to get to this place to mess my body up, but it's coming together now. So I think it's great, and I just keep looking to see what advancements I'll be receiving as I continue to take the product. So I pray to all of you, if you start on the products, give it time to do what it's supposed to do, because minerals and vitamins do not work like pharmaceuticals that give you a fast benefit, but it's never healing. The macrodaily might work a little slower, but it is healing your body. So stay with it, but do get started. God bless you.
Wow.
Pretty amazing. Yeah, pretty amazing, Jonathan.
Wow.
I'll pass it back over to you. But earlier you had a conversation about priceless. That extra time with your mom. Well, imagine somebody here already committed for over a year, almost a year and a half of not urinating at all, having a dialysis take all of that out. I mean, basically 3 times a week, down to where his kidneys are coming back online. So talk about some hope for many.
That's incredible. Thank you very much for sharing that additional. So there you have it. Those are some comments from Dr. Prasad, and as you can see, some amazing testimonials of individuals who benefited from Dr. Prasad's formulas. You know, we say again, and we'll repeat it over and over and over again, that when it comes right down to it, we're not allowed to make any kind of medical claims. In fact, we are quick to tell you that results are atypical, and we strongly recommend that you seek the competent medical advice of professionals that you trust. But this is the product that everyone's talking about. The original formula is also still available. The capsules and the hydro version of it all available. This is incredibly important, having the right probiotics to go along with it, because did you know that every disease in your body has a fingerprint in the gut? So if you don't put some probiotics in and change your microbiome, we could be allowing disease to flourish unabated. Omega-3, critically important for the heart, for circulation, for the brain. This is a positive support no matter what. Structural support for organs, the collagen peptide. This is one of the most amazing products that Dr. Prasad has ever formulated. So make sure that you add this. So we're talking about the core four, basically. That's the essence of it, is the core four. And you can't go wrong with that. If you are having some serious challenges, I would recommend add one more dose of any one of the other micro daily products twice per day. Another dose per day, go on a chronic level dose, and you'll see some even better results. If you have problems with digestion, there's a digestive boost. If your memory's a little bit slow, you want some get up and go, this brain boost is off the Richter scale good. Need a little extra help sleeping? This will do it. This will help you to sleep deeper and hit REM sleep. Having trouble with anxiety? Dr. Prasad isolated a CBD component. It's not just a full spectrum CBD, it's a CBD isolate. So it's the best part of the CBD, and it's extracted from hemp, not from marijuana or anything like that. It's from the hemp plant. So this is outstanding. So the core four is the way to go. And there's special pricing during the month of kidney awareness. I think this price is a little bit off. It may be about $5 or $6 higher, the cost, because of inflation, but it's still a substantial discount. The discount price you'll get is even lower than what we would get it for as a distributor. Distributor would get it for about $250, $260. So you, as a brand new person, can get this on subscription for about $205, I think it is the price. But anyway, the person who invited you here, they'll give you the actual most current prices. This is what Dr. Prasad says is a bare minimum. If somebody really wants to get themselves going and take charge of their health again, you want the basic bundle at the very, very least. So again, just get back with the person who invited you, and they will help you to get started and set up the right combination of products for yourself. And we always like to tell people, remind you, please don't expect a pill, potion, or lotion to do for you what you could do for yourself. Get yourself moving. Change your relationship with your couch, and you'll find that your health can improve just by getting yourself moving. It's amazing what physical activity will do for us. So we strongly recommend try to get yourself in 7,000 steps. I have to keep applauding Coraline, because Coraline has been walking. I think she's already clocked more than 1 million steps, but she does 10,000 steps every single day, and she's been doing it consecutively now for about 1.5 years. So that is someone who's determined to cheat or to extend the quality of her life, and she's taking Dr. Prasad's formula. So kudos again to you, Coraline, for what you are doing and setting such a good example. Charlie Rayford, do you have a final comment here that you want to make? We're past our time.
Okay, I'll make it quick. It was probably in September. I had a client, and he had diabetes. He was taking metformin in capsules, but he was full diabetes. And he called. I put him on the Core 4, and he was on it for 2 months. And he called me as he was still he was in a clinic, but not in the doctor's office. He says, "I just wanted to call you to let you know that I am no longer a diabetic. They put me in the pre-diabetic area." And, and it was only about 2.5, 3 months. and he's still taking the product and doing well.
That's beautiful.
He's-
Thank you very much for
Okay.
your being willing to share that story. So thank you folks very much for joining us, and we'll see you next weekend. We're going to be talking about I think pets and pet health next week. Dr. Prasad's formula is good for your extended family members, your pets.